Hello.
Hello, good morning.
Morning, King. How are you doing?
Pretty good. You?
Yeah, very good. So welcome to my office here at the Magic Centre.
Looks so cool.
Thank you.
So are you ready for your 73 questions?
Can't be more ready.
All right. So first of all, what is your name?
I'm Siew Ng.
Professor Siew Ng. So what specialty are you in?
I'm a gastroenterologist. So basically, I specialize in any part of the intestine from the mouth all the way to the anus.
Do you remember which high school did you study in back then?
Oh, let me think. Actually, I was born and grew up in a little island called Penang off the west coast of Malaysia. So I went to high school there and then left to study college in the United Kingdom.
Oh, is where the accent comes from? Is it the Malay accent or?
Let me think. I think probably a mixture.
Mixture of both.
different
Okay.
types.
So why do you actually study medicine then?
In England, so I went to St Bartholomew's and the Royal London School of Medicine and Dentistry.
So what specialty do you actually want to go to in the first year of med school?
Ironically, I think I wanted to be a surgeon when I went to medical school, actually, because I thought my personality is I quite like outcome-driven stuff, so quite a quick fix. So surgeons could probably remove certain tumor and then get rid of it to cure the patient.
But then what changed then?
Throughout my rotations, I then shifted towards wanted to do oncology, GI oncology, because I was in the cutting-edge centre in the Middlesex Hospital in England. And then I realised I love solving puzzles and maybe speaking to patients. So that's how probably I end up being a gastroenterologist, because it gives you a bit of both. The hands-on experience of procedures, but at the same time also the sort of thinking had. But probably I think usually what inspired me most was probably the mentor, because I was working with people in the gastroenterology field who were charming and visionary. So I think that was also part of the reason which makes me being a gastroenterologist today.
That makes sense. Actually, to call out, there's actually Dean Chen in the background and Professor So in the background.
Oh yeah. So this is a picture of Professor So and Professor Dean Chen, and so they're both my mentors in the field of gastroenterology when I joined CUHK. And I think there's this naturally sort of inspiring and enterprising character. Not that I'm biased of gastroenterologists, and which is why I think for those who had this sort of personality, it's quite a nice field to go into.
Is there any fond moment that you would like to remember during your med school period?
Let me think. Well, when I was in medical school, if I think about things within medicine, itself, I had the opportunity to work in two very diverse places. So when I joined the medical school, St Bartholomew's had just merged with Royal London Hospital, and Royal London Hospital is located at the east end of London, which is very underprivileged, impoverished areas, and St Bartholomew was at the west end. So when I was studying medicine, I think being attached to different specialties, seeing how medicine can be so different in terms of healthcare and discrepancy in terms of the culture and the people was quite interesting. But probably the fond memories of the people. I think we need to have friends, and I was staying at Whitechapel. I don't know whether you know King, which is the east end of London, and that's where Jack the Ripper, this is story began, and my accommodation was just next to it. So there are lots of fond memories at night with my peers.
Any ghost stories?
Very much so, to distress, or maybe to stress itself.
So how long did actually gastroenterology training take after med school?
After medical school, to be a gastroenterologist, usually there's 1 year of intern. At my time, it's called the house officer year. Then the basic physician training is about 2 to 3 years. Then you choose to specialize. For that, it's about 5 to 6 years. For me, I also did a PhD in between my higher physician training. So that's probably over a decade, more than 10 years for training in total.
I bet it's worth it a lot. It's worth it. All right, so do you think your specialty is competitive, and it's why?
I think every single specialty is competitive, so probably shouldn't not go into a specialty because of the competition.
Yeah.
I think probably should be the passion and what you really sort of enjoy. So in short, yes, I think a lot of people find gastroenterology quite a popular field to go into.
on the topic of choosing specialty, why should someone choose your specialty then? What kind of quality that you're looking for?
Interesting. If you like to use your hands to do procedures, but also at the same time maybe like to use your brain or like to meet people to chat to them, I think these are three quite important things which gastroenterology sort of offers. But no disrespect to cardiologists or nephrologists, but the gut is very intriguing because it's not one organ, unlike other specialty. So some people specialize in the esophagus, in the stomach, in the small and the large bowels. For example, for me, I specialize in inflammatory bowel disease, so I deal mainly with the small and the large intestine. But you can do the pancreas, the liver, or even be an interventional endoscopist. So I think it offers a variety of options when you become a gastroenterologist. Probably, I think the most exciting part is it's quite a close-knit family. So we call it the GI big family, at least at CUHK. So people are generally very friendly and work as a team.
So on the contrary, is there any reason why someone should not choose gastroenterology then?
If you're disgusted by poo and puke,
that's true.
I think some people find it very hard if this is what you have to deal with every single day. A separate reason is if you find it quite hard to make decision under pressure, because as an endoscopist, when you have a big GI bleeders or you have any emergency, you really need to make that sort of decision under a lot of pressure. And of course, teamwork, because we work closely with the surgeons as well. So those who find they don't really enjoy too much multidisciplinary type of stuff, maybe should consider other specialty.
Is there any stereotypes that you can think of for gastroenterology?
Stereotype. Some people may comment that going to gastroenterology is like a money-making business because it's quite lucrative, and people may think, well, become a gastroenterologist, I can then go in a private practice, and procedures clearly cost a lot of money. But probably there's not so much truth, in there, because a lot of people I know still stay within academic and still enjoy the research that they are sort of doing. The other stereotype, I think in a good way, is that I've heard that gastroenterologists are naturally quite enterprising and kind of naturally born leaders, because I've known several gastroenterologists, not to mention Professor Francis Chan, Professor Joseph Song, who actually are sort of big leaders in the field and also within the administrative system. So it allows you to maybe be more creative as well if you do that.
So is there any stereotype you can think of that is actually true?
I think the ones that's true are they have itchy hands, they like to do procedures, but at the same time they also want the best of both worlds. They also want to be well balanced and be able to practice medicine at a higher level. So generally, gastroenterologists are quite overall and well balanced, in my sort of humble opinion.
So do you remember during your med school, the award rounds, what are the most likely questions that people ask you?
Loads of them. My first intern job was a difficult one. When I first graduated, I went into hematology oncology as a house officer. So to deal with kids with leukemia and lymphoma. And I think during that ward round, the first question I always get asked is, what's a neutrophil count? What's a white cell count? What's a platelet count? And I had to memorize this on top of my head. So those were the days.
Those were the days. So on the contrary, during your ward round, what kind of questions do you ask your residents?
Have I thought you before, kid? So if it's a medical student, usually when I take them to a ward round, I would give them a few seconds and then I'll ask them to turn their back towards me and I'll say, what do you notice about this patient? And a lot of times I'm astonished by how we don't observe things enough. So, for example, I expect them to say, look, this is a cacting, elderly man, or this is someone who is completely jaundiced, or have an acidic drain being put in. Little things like this, I think, allows you to have a clinical sense over time, and you form already a picture. And I think as a doctor, we need to be very observant. And usually that's the first question I ask if it's a medical student. If it's a resident doctor, then my goal question is, as a consultant, only allow you to order one investigation for this patient to make the diagnosis.
Okay.
What will you do? And that, I think, trains people to prioritize. Because in this world now, we just throw all the 10 tests for patients without really thinking. But when you are needed to ration, then you think clearly what's your top diagnosis and what is the test that will allow you to really get there.
As I can notice, the background is quite unique. I think not many people are studying CUHK, or probably not in Hong Kong. So can you explain magic and also the scenery behind?
We are very lucky. If you look behind, that's the campus of the Chinese University of Hong Kong. So this is the one of the InnoHK supported by the Innovation and Technology Bureau to essentially sort of stimulate innovations and inventions development and turn them to help the society. So we built the center, you can see it's called Microbiota I Centre, working mainly to harvest the microbiome inside the gut to turn them into a new generation of medicine to help different diseases. So the background is, beautiful. In fact, there's a land there that is the CUHK and is building also a big research center, probably be ready in a few years' time. And I know that many of my colleagues live in the campus just there, so I can wave to them, which is where the accommodation is actually for the different colleges.
Oh, that's true. Yeah. All right, so going back to your journey to becoming a doctor, how did you deal with the exam or stress that was along the way?
I think it's difficult. Sometimes I don't think so much of it and just get on with it. But I think some people may find it stressful, and having peer support is very important. So usually I find that you have categories of friends. So for example, you have the venting buddies that you vent to, the spiritual buddy, the traveling buddy, and people at work and outside work as well. So for that, it's I think very, very important. I mean, for me, I like sports, so maybe going for a run or have a glass of wine at night. I think that always does the job.
That's true. All right, so actually with magic and mine also being a professor, actually what do you do on an average day?
It varies day to day. So give an example of yesterday. So yesterday in the morning I had like a research meeting with some of the students and looking through their papers. And then I went over to the Siew Ng Centre to do a few colonoscopies, and then I saw a few consultations and patients as well. Then after that, in the afternoon, it's mostly, as an academic, I have to give a talk, and then several research meetings and grant writing proposals as well. And then at night, because now everything is Zoom at the moment, so I gave a talk online in Zoom.
That's quite a hectic schedule, actually. So during a normal day, what is the balance of procedure and clinic like?
For me, in the past, what I used to do is, for example, half a day could be doing endoscopies, and the other half a day doing clinics with patients. So it's probably about half-half. But right now, I moved to this innovation center. I also do a lot more academic sort of stuff.
So can you recall what is the most unforgettable cases that you've encountered?
There are quite a few, but I'll probably describe one that always sticks to my head. So this was about 5 years ago. We started a service called fecal microbiota transplantation in CUHK. And this 70-year-old man came to see me because he had been around several famous doctors in China with diarrhea and recurrent C. diff infection, but hasn't been able to relieve his symptoms. So he wanted to do FMT, basically. So essentially, we needed to find a donor, So in the early days, his son acted as a donor. So his son came, donated the fecal material, we extracted the bacteria, then we transferred to the father through a colonoscopy. And it was so memorable because it was it's the first case I've ever sort of done. And then I got a call 6 hours later from my secretary saying this man wanted to speak to me. And my heart just sank thinking, oh no, there may be some immediate side effects. And he said, Dr. Ng, I want to bow to you 3 times because for the first time for 3 years, he's seen normal form stool and he no longer has abdominal pain. So that's quite memorable because it's quite rewarding to see how a treatment can be so miraculous to help patients. He even wrote a poem about poop transplant to me, and he's now an artist running book exhibition. Yeah.
All right, so I'm very curious. Actually, what is this area?
Oh, so this area is quite special. This is what we call the business reception. Because as you know, the Microbiota Innovation Centre aims to do innovation and then entrepreneurship as well. So we have maybe investors and people come here. So we will sit here and brainstorm some ideas about how to turn certain products into commercial sort of products for the society. So this is where a lot of the ideas come out. And I think sometimes you need this sort of space in order to bring that out.
Yeah, I would like to spend some time here too if I'm an investor.
Most welcome.
All right, so what is the most common procedure you actually do apart from, say, fecal microbiota transplant?
I do mostly colonoscopies and also upper GI endoscopies as well. Yeah, so these are the 2 procedures. In the past, I also do some ERCPs, but now mainly is colonoscopy.
So what do you think is the toughest part of your job?
Ooh, I think being out of the comfort zone sometimes, because when you do procedures, sometimes you never know what you encounter, for example, and you have to make immediate decisions. That is wearing the doctor's hat. But I think right now it's managing people, because as this center, there are over hundreds of staffs and different expectations. So for me, I can't wear different hats each day, and I have to think, oh, what hat am I wearing? Which one it is today, and how to meet their expectations.
That's true. And I see this poster behind that is quite pun intended.
So there's a reason for it. As you can see, the reason why it's called magic, because we all have magic inside us, and that's what we meant by the gut bacteria, the microbes, those invisible, and then make SHIT happen. But no guts, no glory. The best is microbiome rules. So that's why it's the motto of the center.
So can I say that the most rewarding aspect of the job is actually this company and also able to help many people through microbiota transplant?
Yes, I think it's rewarding for me to actually see people get better. So with fecal transplant, it's very miraculous. It works very well in 90%. But the other thing I do is also I see a lot of kids with inflammatory bowel disease. This is a chronic condition. So I've 6-year-old children who followed me now up to maybe 16 years old. So it's rewarding to see them get better with new drugs, and now they can go back to their normal lives.
So how many patients do you actually see on an average day?
When I was at the Prince of Wales Hospital, probably in a busy clinic, it can be 20 to 30, a day. But now much less, sometimes maybe 10 to 15 a day.
10 to 15. So how many hours do you work on an average week then?
Normally I start my day from maybe 6 in the morning, and then 12 hours a day times 5, maybe 60 to 70 a week. Yes, on a busy week.
On a busy week.
Do you want a drink or anything?
Oh, sure.
Yeah, okay. Get you some water. So this is the pantry. We created this space because we think it's quite important for people to mingle. Yeah. Because if you want to do innovation, an idea comes when you kind of work together, and a lot of new ideas always comes not by just in meetings, but through having a cup of coffee or having a glass of
and also a space to rest for a while.
Yes.
Thank you.
This is for you. I get one for myself.
So, do you think that you need to take calls now or during your interns or the entire process, how many days do you take calls?
In the intern years when I was in London, I think those were probably once every 2 or 3 days. But fortunately, now for the calls in the past few years, I do endoscopy call. So it could be like the second on call. So it's mainly to provide support to the residents or the physicians or trainees if they have any sort of problem. So you don't necessarily need to be on site.
Okay, that's good.
Yes.
But 2 calls a day, it's really, really tough actually.
It is.
I can imagine going into house menu. It's
Yes.
going to be tough.
Perpetually sleep deprived.
Yeah. So do you consider yourself a day shift or a night shift person?
Definitely a day shift.
Day shift.
But I think night shift has its reason. Night shift really is the time where you learn the most. I think one night shift, you can probably learn everything you learn in like a month sometimes. As I always remember the most memorable night, like I had 5 emergency cases at one go, one with meningitis, one acute nephritis, one with probably pneumothorax, and someone who's got a ruptured appendix, all coming at the same time. So I think this is where you really learn the most in just one night.
So how do you actually stay awake during your shift then?
Be on the move all the time,
Okay.
and maybe with a can of Coke.
Okay, cool.
So
Okay.
so I find just going around at night, I think it's hard to sit down to take a history. I remember once I sat down to take a history from this elderly man, and then halfway through he said, "Doctor, you must be so tired." I think I had probably dozed off for 10 seconds during my history taking, but I think that's what happens when you've been perpetually on nights all the time. But it's good to be on the move.
So can you think of any random like medical or nerdy facts?
Right now it has to do with something I've been working on, and
Okay.
that is you are more microbes than you are human. So I think this stems from the fact that we are actually only 1% human now, because 99% of your DNA are the bacterial DNA inside you. So I always said, when you look at yourself in the mirror, you realize that actually it's not you, it's all the microbes that actually make up you. So for example, here, when we created this magic philosophy, you would see that here your face, right, your skin are all full of bacteria, and your hands as well, and inside your gut. So that's why we said microbiome rules.